walked in. He was scheduled for 7, and he waited until 4 o'clock. He couldn't eat. He was walking around in the gown with his fanny sticking out. And then he gets a bill for $70,000. Now, his insurance paid $50,000, but he had to pay the copay. So he got stuck with that bill when he could have had the same procedure the same day with us for 95% less and be done on time and not have to wait and not have to suffer all day not eating and walking around in a gown. There's a big difference being treated in our cancer treatment center and some of the big hospitals where maybe they don't treat people the same way. So that's just one example of why you might want to consider coming to Radiosurgery New York for your care. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We take care of people with cancer, whether it's new cancer, old cancer, no matter what. We take care of people with cancer at 1384 Broadway and 38th Street. We're going to hear from our sponsor for just a moment, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back, and we hope you're doing great. We have many people listen to all 5 shows every weekend. We have 5 unique shows every weekend, and this is ending up in just a few minutes, so we wanted to talk about other things, but I just want you to be aware that on WOR, which is 710 radio, we have 4 shows on Sunday. One's at 1:30 in the morning, one's at 3 in the morning, one's at 6 in the morning, and one's at 9 p.m. at night. So every weekend we have 5 unique shows and 5 chances to speak and to ask questions and to learn about a lot of different things. There's a lot of different things. Wow, from acoustic neuromas to ampulla of Vater cancer. Those are just in the A section of work that we do. We had a woman who came in. We treated her 2 years ago for breast cancer. I haven't seen her in 2 years. You can say, why? Well, we encourage people to come back, but she has other doctors, and she went to the other doctors. She's doing well. She had breast cancer. She's in complete remission. Her cancer markers are negative. Her exam is negative. Everything's negative. But she has a new tumor called a meningioma, which is a growing tumor on the meninges. The meninges are the covering of the brain. So it's interesting because about 6 times more women get meningiomas than men. Many people speculate that it's related to hormone because of that sex differential, 6 to 1, women to men. Her tumor is pretty good size. It's about 3 centimeters, so about 1.5 inches, right in the middle of the brain. She wants that treated. She wants to get rid of that thing so it doesn't grow and cause harm. Our success rate for meningiomas is about 97%. We've treated many, many meningiomas. We were the first in New York to perform radiosurgery. We have a team and a group that's together, and we're devoted to radiosurgery. And you too, if you have meningioma or other disease, may want to be considered. So this woman's going to start treatment. She's finished treatment 2 years ago for the breast. And what was the result of the breast? Well, cancer-free. The breast looks good. She's happy. She's back to have more treatment, and she wants very much to have the treatment for the meningioma in the head. She doesn't want problems with her head, and that's where we're going to start. She wants to start ASAP, and we listen to the patient because the patient is the president of the United States of their body. And in the good news department, we have a young woman, she's about 30, with a sarcoma, which is a cancer of the connective tissue. So it usually affects the bones and the muscles. And in her case, it's affected the hand and wrist muscles. She had surgery and then came to us for post-surgical treatment, which we treated her about 2 years ago. She just came this week to be staged up, and we staged her up about 2 years after treatment, and she's in complete remission. We gave her, I hope, what she considers good advice to make her hand as strong as the other hand, and then we'll see her back on a regular basis. But we treat many people with sarcomas. We actually had a woman, and I spoke to you a little bit about her a few weeks ago, a woman from Long Island who had a sarcoma of the leg, and when they removed it, elsewhere they removed it, but the margins were 0.5 millimeters, almost paper-thin margins. Now, in general, if you have surgery for cancer, you want to make sure that the surgeon removes the cancer without touching the cancer, because when they touch the cancer, that can tend to spread the cancer. So in her case, she had a big tumor, and the margins were 0.5 millimeters. It was a liposarcoma. Her tumor was 10.5 centimeters in maximum size. She had surgery and standard radiation elsewhere. And then a year ago, she had pain in the hip and difficulty moving. She was seen by doctors. Then they told her just to come back in 4 months. And then they did a scan, and they saw a 6-centimeter mass in the bone on the left side. And then they biopsied her, didn't get cancer, and told her to wait. She came to us. We treated her 5 treatments, and the pain's gone away. She's walking better, doing better, and tells you how different cancer treatment can be in a different facility. You may want to get a fresh second opinion if you are not satisfied, if you're having symptoms, or if your treatment's not tolerated. You may wish to be considered for a second opinion. My name is Dr. Lederman at Radiosurgery New York. We take care of new patients with cancer. We take care of patients whose treatment isn't tolerable or hasn't worked. So give us a call at 212-CHOICES. That's 212-246-4237. You can call day or night about your cancer. Please give us a call. We hope you have a great weekend, and turn in on WOR tomorrow. Thank you, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES. Two choices. Two choices. Two choices. Two choices. Two choices. Two choices.